I have seen in the circles Secular Pro-Life runs in, people claim that if you are a medical professional, whether in obstetrics or not, but especially in obstetrics, and you oppose abortion, you should find a different profession entirely. And in addition to, conscientious objections and free speech issues and so forth, one of the things that we talk about is what does that mean for the millions of patients who would not just accept but prefer medical professionals who share their views on the value of prenatal life and how to handle these complicated issues.
Hi, welcome to Caring for Both. This is a curbside consult series by the American Association of Pro-Life OB-GYNs, or AAPLOG. On this podcast, we bring on experts to provide insights to support you as a medical professional in your life-affirming practice and career. I'm your host for today, Dr. Christina Francis, a board-certified OB-GYN and also CEO of AAPLOG. And today I'm so happy to be back with Monica Snyder, Executive Director of Secular Pro-Life. Secular Pro-Life is an amazing nonprofit organization committed to advancing secular arguments against abortion, creating a pro-life space for non-religious people, and building interfaith coalitions of people interested in advancing secular arguments. For many of you, that might be shocking to hear, but we're so excited. It's such a great organization. Monica has degrees in chemical biology and forensic science. She started volunteering for Secular Pro-Life in 2009 and then became its executive director in 2021. As the head of Secular Pro-Life, she maintains the organization's strong social online presence. Many of you have probably seen them online, advancing pro-life arguments on social media and publishing robust resources on the organization's blog. And I would highly encourage you to check it out if you haven't. They have amazing content on their website and on their social media accounts. So a few weeks ago, Monica and I had sat down actually at our national conference for a bit of a reverse interview where she asked me questions that she'd gathered from her followers around the theme of what patients and pro-life advocates might be asking of physicians. We enjoyed this format so much that we decided to continue this conversation with more questions from the Secular Pro-Life followers. So Monica, let's jump in. I'm really excited to start, and let us know what you've got for us today.
Yeah, thanks for coming back again. I'm really enjoying getting a chance to take what our followers are asking and speak to an expert. Today, I wanted to focus a little bit more on what not just pro-life OBs, but OBs across the country think about abortion. We see a lot of media coverage that suggests almost a monolith, as if everybody who works in obstetrics agrees on the ethics and the legality of abortion. So the first question that our followers were kind of asking was, what do American OB-GYNs think about abortion? Do we have data to give us some insight into what proportions of this population support or don't support legal elective abortion?
Yeah, it's a great question because I think, as you said, if you just pay attention to social media or the mainstream media, you might think that every doctor in this country was upset over the Dobbs decision and over the fact that now in some states they're not able to do induced abortions. But actually, if you look at the data that we do have, which really the data that I'm aware of surveyed OB-GYNs as to whether or not they perform abortions as part of their practice. So of course, that doesn't necessarily tell us whether they're pro-life or pro-choice, but it certainly says, what do they do with their practice? As you said, how do they view induced abortion? Because if they viewed it as essential healthcare for women, then you would think that most OB-GYNs would be doing it because we're women's healthcare specialists. So there were really three main studies that were done in the years leading up to the Dobbs decision. So from about 2016 to 2019. And those looked at different groups of physicians. So one of the studies looked at academic physicians, so those that are practicing in big academic centers. Another study looked at physicians in private practice. And then the other study was sort of a mix of the two. And what it showed was that about 76% of academic OB-GYNs did not perform abortions, and 93% of private practice OB-GYNs did not perform abortions. And then the one that was mixed was right in between, about 86% that did not do abortions. So what that says is that even in academia, where I think, my mind would certainly automatically go that most of those physicians are probably doing abortions, still 3/4 of those OB-GYNs were not doing abortions. And I think it's important to point out because since the Dobbs decision, of course, there's been all this confusion, maybe intentional on in some instances, maybe not intentional in other instances, but there's been this confusion around the word abortion. What does that mean? Does it mean, taking care of miscarriages? Does it mean taking care of ectopic pregnancies? Does it mean treating women with life-threatening complications? I think it's important to note that these surveys were done before Dobbs, so before this confusion started, and the physicians inherently knew what they were being asked. They were asked, do you do abortions as part of your practice? And again, in the one study, 93% of them said no. So they understood when they were asked, do you do abortions, that was referring to procedures that are done with the intent of ending the life of the fetal human being, of the preborn human being. And so 93% of them said no. I guarantee you, if not 100% of those people surveyed, certainly close to 100%. We're treating miscarriages, we're treating ectopic pregnancies, we're treating life-threatening complications of pregnancy, but they understood that that's not what was meant by the word abortion. So I think that's really important to point out because now we hear, oh, doctors are so confused. Doctors are not confused, or they shouldn't be confused, I should say. They shouldn't be confused. They knew before this kind of blew up on a political level and, on sort of a cultural level, they understood what the word abortion meant.
That makes a lot of sense. And it's a really intriguing point when we say now that we see this idea that advocates against abortion are just misunderstanding that it's essential health care and abortion is essential health care. It's interesting to think about how before Dobbs, the overwhelming majority of OBs said that they do not provide it. And so whatever they meant by that, presumably they believe they provide essential health care. So there's some kind of disconnect there.
Yeah, absolutely.
Similar to that, the AAPLOG is actually the premier organization for professional membership for people working in obstetrics. And as far as I can tell, as a layperson, they do not know of an abortion they don't approve of. They are very one-sided in their advocacy about abortion. And often when they are referenced in media, they are referenced as if they're, how many members they have? Thousands, tens of thousands of members all agree with them on their policy positions on abortion. Is that accurate? Do they accurately represent the views of their membership? And how would we know whether they do or not?
Well, I think, based on the numbers that we just talked about 93% of OB-GYNs not doing abortions, that alone shows us that AAPLOG does not represent their membership on their positions. And so, AAPLOG recently in 2023, I believe it was, came out in a letter to the editor of the Washington Post and said that abortion should be available. And they're talking induced abortion here. They're talking, elective induced abortion. So not treating any kind of life-threatening complication. Should be available without restriction, without regulation, and open access, meaning through all 9 months of pregnancy. That is their official position, and they have doubled down on it. That is so out of step, not only with the American public, but it's out of step with good medical care, and it's out of step, obviously, with the vast majority of OB-GYNs. So, even if you look at so let's take that one survey that showed that 93% of OB-GYNs don't do abortions. Even if you look at the 7% who said they did, I guarantee you the vast majority of them would not be comfortable doing a 3rd trimester abortion, for instance. And,
right.
And yet AAPLOG is saying you shouldn't even have to justify why you're doing a 3rd trimester abortion. It should be available without restriction. And so obviously that's completely out of step with the vast majority of their membership. And, we've seen their position on abortion just become radically more progressive, I guess, or more, it's probably a bad word to use, kind of a loaded term, just more radical, I guess, would be the best way to say it, over the last decade or so. Really starting back in 2008, I believe it was, when they first issued their ethics statement 385, which said that physicians should actually not be allowed to completely abstain from referring for abortion, that if you had a moral or a conscientious objection to abortion, you should actually have to relocate your practice to within 30 miles of someone who would do an abortion. And that was sort of the start of then and now they've just completely gone away from the medical evidence. I testified in a congressional hearing 2 summers ago when a representative of ACOG stated that ACOG categorically denies any link between abortion and preterm birth, which we know that there's 160 studies that show a link between those two things. The Institute of Medicine has acknowledged it. There are huge, I know you guys, Monica, have done some posts on this. There are huge meta-analyses that have looked at this that have shown, yes, in fact, there is a causative factor there between induced abortion and preterm birth. So, for them to say they categorically deny that there's any evidence, I mean, we can argue about how strong the evidence might be and, how strong this study is, but for them to just say that there is no evidence whatsoever, I think just shows that they're choosing this radical political position over sound medicine and sound science. And that really is woefully out of step with a lot of their membership. Unfortunately, I think a lot of their members who aren't as steeped in this issue as you and I are, don't realize that that's actually ACOG's position.
Right. I've seen that to be the case also. Given that really extreme position where they're sort of taking every instance that they can to promote abortion without restriction, is there a way for AAPLOG to work with or alongside them where there's common ground, or at least have conversations about these very different views about what is reasonable to practice in medicine? Do you have a relationship with ACOG where you can have these conversations?
Well, you would think that we would, because we started within ACOG and we were in ACOG for 40 years as a special interest group until we became our own separate organization in 2013. And we used to exhibit at their conferences and we used to be able to have some discussions, but more and more over the last few years, that has dwindled, not because of us being unwilling to talk with them, but because of them being unwilling to engage with us. And it really came to a head just a little over a year ago when we were essentially kicked out of their conference that they have for medical educators every year. We had exhibited at that conference for every year for the last 15 years. We had signed up for our booth a year before the conference. And I was actually in town in the DC area ready to exhibit at the conference when we were informed, literally the wording was, your booth has been canceled, which is a little bit rich, I think. But anyways, we were kicked out of their conference and told, they said on the record to a reporter that the reason that we were no longer going to be allowed at their conferences was because we were pro-life. And this was a place where those who are educating the next generation of OB-GYNs were at. This was a very important conference for us to present two sides of this very important issue. It's really important for those of us who are physicians, anyone, I think, who's in medicine, as you're being trained in medicine, it's important to learn how to critically evaluate evidence, to weigh both sides of an issue or two kinds of treatment maybe for a disease and see which does the evidence better support, what's better for my patients. And that's being kept now from trainees that are learning in OB-GYN. And so after we were kicked out of their conference, we sent a debate invitation. Duke University was actually willing to host a debate between myself and the CEO of ACOG. We had a debate topic chosen and we were ready to go. We sent the debate invitation to their CEO and to their board, and they declined the debate and said that they refused to engage in debate because the role of induced abortion in our patients' lives was settled science and there was no reason to have a discussion. So, we are willing to engage with those who disagree with us. In fact, I enjoy that. Many of our leadership, many of our members enjoy having these robust academic discussions and respectful debate. But unfortunately, ACOG has been unwilling. And I think they're really doing a huge disservice, not only to their members and future OB-GYNs, but also a huge disservice to our patients.
Yes. Well, sort of related to that, actually, I have seen in the circles secular pro-life runs in people claim that if you are a medical professional, whether in obstetrics or not, but especially in obstetrics, and you oppose abortion, you should find a different profession entirely. And in addition to, conscientious objections and free speech issues and so forth, one of the things that we talk about is what does that mean for the millions of patients who would not just accept but prefer medical professionals who share their views on the value of prenatal life and how to handle these complicated issues, who prefer pro-life medical professionals. Have you had people tell you similar, and what is your response to them?
Yeah, I have. So I think a couple things. First of all, it's not just you hearing that in the media or things like that, or maybe people that you're engaging with on social media. There was actually an academic article that was written by Ezekiel Emanuel, which some people may recognize that name. He was one of the architects actually of the Affordable Care Act, working with President Obama. And he wrote an article about conscientious objection and basically said, and this is almost a direct quote, it may not be exact, but almost a direct quote. He said at the very end of the article that if you as a physician had a moral objection to settled science within medicine, such as abortion was his example, that you should either go into a field like radiology where that wouldn't cause an issue, or you should leave the profession of medicine. So we actually have physicians that are saying it in academic journals. So unfortunately, this is being pushed, but you're exactly right, Monica, in that there are patients that are actively seeking pro-life physicians. I think honestly, even patients who maybe aren't 100% pro-life themselves, because they want to know that if they're facing a pregnancy complication or they're at risk of losing their baby, they want to know that they're going to go to a physician who is going to fight so hard for both them and their baby, because they value their child's life as well as theirs. And so you're right, there's a lot of patients. It's one of the most visited parts of our website, actually, is our directory, where women are coming and looking for a pro-life physician in their area. The other thing I think we need to think about is if we continue to allow the establishment, the medical establishment, medical schools, things like that, to actively push out of practice anyone who is a Hippocratic physician who says, I will not use death as a therapeutic modality in my practice of medicine, we are going to exacerbate a crisis that already exists in this country, which is we have maternity care deserts all over this country where women who want their pregnancies, who want good prenatal care, don't have access to that. They don't have access to a labor and delivery unit that's close to them in case they have an emergency. They don't have access to blood products if they're hemorrhaging. All of these things. We are going to exacerbate that problem, because guess what happens when you can't find a physician to staff a labor and delivery unit? That labor and delivery unit closes. And we're seeing that. We've been seeing it for the last decade all over this country. And so if we actively push out physicians who are pro-life, we are going to exacerbate that as well. So not only is that going to impact patients who want a pro-life physician, it's going to impact women across the country regardless of their views on abortion, because they're not going to have access to a physician when they need one. And so I think it's a really important point that you bring up, that this isn't just about protecting physicians' ability to practice, for ourselves. It's about protecting access in general to healthcare for women, but also protecting the ability for women who want to see a pro-life physician to be able to find one.
Speaking of that, if you are listening to this and you are a person who wants to find pro-life care, I know that AAPLOG has a wonderful database where you can check for people who have stated that they can be part of it, and they can check their state to see if they have a established pro-life physician. But I also know that there are a lot of pro-life physicians who aren't in the AAPLOG database, who might not want to be that directly connected. Do you have any thoughts on how someone could go about in their own local community sort of vetting their obstetrics teams for these kinds of issues, sort of making sure that they don't end up with a team who is going to pressure them in a direction they don't want to go if they have a complicated pregnancy? How can I, as a woman who can get pregnant, make sure that my team would never push the option of abortion when that's not something I want to consider?
Yeah, absolutely. I think it's a great question. And I think it's actually an important thing for women when they're seeking new care to ask about. I think there's a few different ways that women could go about it. I mean, one, if you're bold enough, you could just outright ask your physician if they do elective abortions or induced abortions. Some people may feel comfortable asking that, some people may not. I think it's a great question to ask. And if they say yes, maybe ask them why. And it could be a good chance to have a conversation too. And if they say no, then then you at least have your answer that they don't do it. Now, again, just because they don't do abortions may not necessarily mean that they are pro-life. But I've often thought that for many physicians who choose not to do them, there's got to be some reason for that. Now, it may be that, especially now, it may be that they work in a state where abortion is now illegal and so they can't do it. But I also think that for many physicians deep down who don't do abortions and maybe work in an area where they could, for many of them, I think it's because deep down they understand that that's not why they went into this profession, that they went into this profession to take care of women and their children. And so something doesn't sit right with them. So one tact may just be to ask them outright. Another thing is that, many physician groups now are hospital owned. And so it should be fairly easy to find out if the hospital where you go does induce abortions. And if so, then it may be more likely that the physician that you're going to see does. If the hospital doesn't, then most likely the physicians at that hospital are not doing them unless they're doing them elsewhere, like at a Planned Parenthood or something like that. So that's another way that you can look into it. The other thing is, I think you could ask your physician, especially if you're newly pregnant and you're going, you could ask your physician, in general, what's your recommendation? Like, let's say I find out that my baby has some kind of abnormality or an adverse diagnosis. In general, what do you typically recommend to patients in that situation? And I think you'll be able to tell by their answer sort of where they lean. I think many physicians who are themselves pro-life might talk about that an abortion or termination of pregnancy is an option, but they're probably going to get to that last. And I think you'll probably be able to tell by the way they answer the question, kind of what their feelings might be on the subject of abortion in those circumstances. Right. So those are some ways. And, as a physician, personally, I wouldn't be offended in being asked those questions. I think those are good questions for any patient to ask. And I think that would be a good place to start. And as you said, they can check on our website too and see if they can find a member of AAPLOG in their area. I will say if you live in a state that tends to be very pro-abortion, you are not likely to find a lot of listed physicians. That does not mean that we don't have members in your area, but many physicians who work in very pro-abortion states are very nervous to list publicly that they are pro-life.
So in those cases, could a patient contact AAPLOG directly and ask for some sort of private information? Not private information, but some sort of workaround where these people aren't necessarily in the database, but you could refer them somehow?
So we have done that in the past. We cannot give out any of our members' information because we've made that promise to them if they have not given us permission to do so. But I have in the past, especially for women who were facing really difficult circumstances, asked their permission to pass their information along to a physician and then have a physician contact them. Right. So sometimes we can do that, certainly.
So we know that pro-life medical professionals who are comfortable being public about it can join this database, can join AAPLOG as dues-paying members, that kind of thing. But what can medical professionals who aren't out as pro-life do to help with pro-life work?
Absolutely. Well, I think there's a number of ways to get involved. And first, I would say that you can absolutely still become a member of AAPLOG. And as I said, we never release our members' information without their permission. So you can be 100% anonymous and be a member. And I would encourage you to do so so that you can stay on top of the latest updates that we have. And also we're involved in several lawsuits actually that are actively protecting the rights of our members to practice medicine in a life-affirming way. And sometimes that protection only applies to those who are members of our organization, depending on where the lawsuit is at in the legal process. So that's a definite benefit to being a member. But I think there are many other ways. One is just being sure that your patients who find themselves in difficult situations, whether it be an adverse diagnosis or an unplanned pregnancy or a situation where a woman is being pressured into an abortion, helping our patients to understand that they have support, that abortion is not their only option, and that we can help them through that. So part of that is being aware of the resources within your own community that are there to help support women who find themselves in these situations. Being aware of organizations such as Be Not Afraid that really come alongside families who have been given an adverse diagnosis and can help support them through that. The other way you can get involved is getting involved with a pregnancy resource center in your community. And that can be done through a variety of means, either being a medical director, which might mean that your name might be a little bit more out there, but also many pregnancy centers are just looking for doctors that they can refer patients to, patients who have chosen life, and they want to know that they're going to send them to a physician who's then not going to turn around and pressure them into an abortion. So that's one way. Many pregnancy centers have classes that physicians can teach, so many ways. So yeah.
Those are great tips. That's very helpful. So for anyone listening to this, whether you are a patient who wants to make sure you have a pro-life team, or whether you are a medical professional who wants to help with pro-life work, even if you're in a difficult community for that, there's always something you can do. And AAPLOG has a lot of resources to help you plug in, so to speak.
Absolutely.
I think that's it for this topic. Thank you so much for answering my followers' questions.
Yeah, absolutely. It's so fun having you on. And I have to say, Monica, we got so much great feedback after our first episode doing this that I think as long as you're okay with it, Monica, I think that we're going to make this sort of a recurring theme here where we have you on to do a reverse interview and ask questions. And so again, for anyone who's listening, I'd encourage you to check out Secular Pro-Life. Monica, what are your social media handles and your website? How can people find you?
So the best way is secularprolife.org. It has all of our content. If you want to go straight to it, you can do secularprolife.org/blog, and we update that multiple times a week. We are also on Twitter X and Instagram and Facebook and Reddit and TikTok, mostly under the username Secular Pro-Life. Some of them there's like dashes in it and stuff. But if you just go to any of these platforms and look up Secular Pro-Life, you will find us, and you should.
Absolutely, they should. Yes. Again, I wholeheartedly recommend their content. It's really, really strong. And especially if you are trying to have a conversation about abortion with somebody who may lean more on the secular side or not be religious and not want to hear those defenses, but to know that there are atheists that are pro-life. There are people of all backgrounds that are pro-life. So we're so appreciative, Monica, of the work that you all are doing. So thank you so much. And thank you to our listeners for joining us today. If you liked this episode, be sure to give us a like and a subscribe on YouTube, or if you're listening on a podcast app, please give us a 5-star review so you move this podcast up to the top of people's feeds. Also, please reach out to us. You can reach out at info@AAPLOG.org if you have ideas for topics that you would like for us to cover on a future podcast episode. We'll see you on our next episode.